Buenos días. Buenos días. Buenos días. Good morning, everyone. Thank you for joining us both here and online. Welcome to the Congressional Hispanic Caucus Institute's 2025 Capitol Hill Briefing Series, Day 3. I'm Marco Davis. I'm the President and CEO of CHCI, and it's my pleasure to welcome you all here. This series is the culmination of CHCI's premier 9-month postgraduate fellowship program, which offers exceptional, unparalleled exposure to hands-on experience in public policy to emerging leaders from the Latino community. This unique fellowship program seeks to enhance participants' leadership abilities, strengthen professional skills, and increase the presence of Latinos in public policy, specifically in the areas of health, technology, housing, law, finance, child welfare, and education. CHCI is thrilled to be able to offer our postgraduate fellows the opportunity to share their perspective on policy issues they're passionate about and convene leaders in this work for an informative conversation. We'd like to thank our postgraduate fellowship sponsors for supporting the program, because without their support, none of this would be possible. And those supporters include the PepsiCo Foundation, America's Health Insurance Plans, Meta, Wells Fargo, Bank of America, Casey Family Programs, the Walton Family Foundation, and Southwest Airlines, the official airline of CHCI's leadership program. To kick off today's discussion, we're proud to welcome Allison Garibay, CHCI's Health Postgraduate Fellow, who will present her briefing titled Breathing Easier, Addressing Asthma in Latino Communities. This spring, Allison has been placed with Congresswoman Lori Trahan from Massachusetts' 3rd District. While Representative Trahan is unable to be here today, she asked me to share the following message on her behalf. She says, Allison has been a dedicated member of her legislative team. Through her position as a CHCI postgraduate fellow, Allison has been a valuable member of Team Trahan, contributing to her work on the House Energy and Commerce Committee's Health Subcommittee. As a heart disease patient and stroke survivor, Allison's personal journey has uniquely positioned her to advocate effectively for patients and families across the Commonwealth and beyond. As a member of the Congressional Hispanic Caucus and the proud granddaughter of Portuguese and Brazilian immigrants, Congresswoman Trahan has seen firsthand the alarming prevalence of preventable health disparities in our nation's Hispanic and Latino communities. The Congresswoman is grateful for Allison's work, shedding light on the social, environmental, and racial inequities that drive the disproportionate burden of diseases like asthma on minority communities. And finally, the Congresswoman appreciates Allison's impactful work in this field, her contributions in the office, and the support from all of you who have joined today to celebrate the culmination of her fellowship. She congratulates Allison on a job well done. I want to thank all of you for being here as well and for supporting our fellows in the vital issues they're working to address. And finally, before I turn it over to Allison, let me just share a tiny bit more about her. Our fellow Allison Garibay holds a bachelor's degree in social work from California State University, Fresno, and a master's in social work from Columbia University. She has several years of experience in local, state, and federal government, which drew her to her work with CHCI. We couldn't be prouder to kick off Day 3 with this session. And please join me in welcoming Allison Garibay.
Good morning, everyone. Thank you, Marco and Representative Lori Trahan, for sending those remarks today and giving us a kind introduction to our conversation on this important topic. Again, thank you for joining us this morning. My name is Allison Garibay, the CHCI Health Postgraduate Fellow and moderator for today's discussion. Today's topic, Breathing Easier, Addressing Asthma in the Latino Population, is close to my heart and deeply entrenched in my community, the Central Valley of California. As someone who has grown up with lung disease and asthma, I understand firsthand just how important this issue is, and I am thankful to CHCI for allowing me to have this platform on Capitol Hill. As previously mentioned, this is a culmination of my educational experience with the Congressional Hispanic Caucus Institute and my own lived experiences. Asthma in the Latino population at a first glance doesn't look quite as concerning as other conditions. When we dive deeper, the social determinants of health, such as housing, environment, work conditions, especially for farm workers and their families, as well as education, we see an alarming rate of underinsured and uninsured Latinos that we hope can be as prevalent and help with these issues. Because of these issues and more, which we will talk about during today's panel, asthma has become an ever-growing concern for physicians and researchers alike. Asthma, for those who may not know, is a chronic lung condition that affects breathing with symptoms including shortness of breath, coughing, wheezing, and chest tightness. In severe asthmatic attacks, it can cause permanent lung damage or even death. Unfortunately, what we are seeing is that 40% of Latino children who are hospitalized with asthma die at a 40% higher rate than their counterparts and peers. Today, I would be remiss if I didn't address the current administration's health priorities, such as cutting $880 billion in Medicaid funds, which create access to healthcare for individuals and families living at or below the poverty line. Latinos in the United States have a disproportionately low rate of healthcare access due to financial costs, makes that as households fearful of deportation, and historically, Latinos wait until emergency situations to seek out healthcare. With the restructuring of HHS, cuts coming to CDC, FDA, and NIH, this conversation is needed now more than ever. Thank you for being here. All right, so to get us started, I'd like to present Jeanette Contreras. She has experience in HHS, NIH, and CMS. Jeanette is the founding executive director of the organization for Latino Health Advocacy, a national organization focused on empowering underserved communities in the U.S. to achieve optimal health and well-being. Prior to launching her organization, she founded Latino Health Lab, a boutique consulting firm focused on helping clients to engage diverse stakeholders in public policy. Welcome, Jeanette.
Thank you. It's so wonderful to be here. I hope that the mic is working. Not only steal one over here. Okay, I'll still go. Yeah, this one's better. So it's a pleasure to be here. Thank you, Allison and CHCI, for inviting me to speak. And this is actually like my homecoming week. I am launching the organization later this week with a press release and official announcement. And so it's really a pleasure. Oh, thank you. I love this snap. Yeah. So our organization is really going to be focused on conducting community-based participatory research so that we actually go into communities, engage with the communities to do research that will then eventually inform public policy development. So I think that one of the things that's missing is that the Latino community, everybody sort of talks about this is what is happening in the Latino community, but we want to hear from the community about what's happening in their communities and how public policies can help improve access to health. And so that is my primary mission. So I'll talk a little bit more about how we'll be doing that and strategies later on, but it's a pleasure to be here. Thank you.
Thank you so much. And my next panelist, we have Jenna Riemenschneider. She is the Vice President of Advocacy and Policy at the Asthma and Allergy Foundation of America, AAFA, the nation's oldest and largest nonprofit patient organization dedicated to improving the lives of over 100 million Americans with asthma, allergies, and related conditions. In this role, Riemenschneider leads AAFA's policy and advocacy initiatives addressing critical issues such as access to care, medicine, and coverage, the health impacts of climate change and air quality, food allergies, and health environments for those with asthma and allergies. She works closely with federal and state lawmakers and officials to advance policies that reduce disease burdens and improve public health outcomes. Through strategic advocacy and grassroots mobilization, Riemenschneider helps amplify the voices of people affected by asthma and allergies, ensuring that policies at the federal and state, as well as local levels, prioritize their needs. Let's give it up for Jenna Riemenschneider.
Well, quite the introduction, so I don't know what I need to add. I will note that, so AFA, what brought me here today and how important this work is, back in 2005, AFA released a report about asthma disparities. We did it again in 2020, and nothing had changed. So all of the stats, we found significant disparities in Black, Hispanic, Indigenous Americans as compared to white Americans. And, there have been moderate advances in public policy in that time, think ACA. And, our mission since then has essentially been, if we do this report again in 15 years, we don't want to be seeing the same numbers. So with that report, we created a roadmap of 19 public policy recommendations, but actually 71 strategies overall. And it has been APA's mission since then to work on addressing disparities in asthma care through our support, research, advocacy, and education in all facets of the organization. This is really our umbrella mission. So I'm happy to be here today and look forward to a really great conversation.
Great, thank you so much. And last but not least, Dr. Elena Rios, President of National Hispanic Health Foundation. Dr. Rios serves as the founder and president of NHHF for 30 years. The mission of the organization is to improve the health of Hispanics and is focused on leadership, educational research, and advocacy activities. Dr. Rios earned her BA from Stanford University, her MSPH at the UCLA School of Public Health, and her MD at UCLA. I'd like to welcome Dr. Elena Rios.
Thank you. I think what's important for you all to know is that through my career as a student for 20 years, I would never recommend that to anybody again, especially with all the debts that young students have these days. But I have to tell you that I learned along the way how few Latinos make it to the halls of higher education. And I think we've seen a big increase. I'll just say that since the last 10 years or so, more students getting their bachelor's. But I just want to encourage students to consider longer term graduate degrees that can open the doors easier and faster for you. And that's why I went to medical school. I was a public health focused student. I came to Washington, D.C. as an intern in 1976 and learned about policies that actually gave financial aid to students who wanted to go to medical school and nursing school, called the HCOP program. And I saw letters written. I was working in a lobbyist organization, one-man show, and I saw letters written by these people named Dr. David Hayes Bautista and Dr. Robert Montoya from California. Little did I know I would meet them. But I just, through the years, going through medical school and residency, I did internal medicine, adult medicine, and I think I realized how chronic diseases are so dehumanizing to our families. We become totally unaware of the outside world, and our families do everything to take care of their children, their parents, their sisters and brothers who are sick. And I saw throughout medicine, and I did residency. I actually trained and did some clinical care with community health centers in Los Angeles while I was a fellow at UCLA. Came to Washington and understood more about the importance of policy making to change the healthcare system. And you can't do it with what everybody here is going to talk about. You can't do it with understanding the connection between the community you want to serve and the policies that exist so that you can adjust them. Things don't happen overnight here. You have to realize that it's little by little that we get change. But if you're not part of the solution and strategies, we're never going to change things for our community. And so I've been a part of that with the National Hispanic Health Foundation. And also, just to mention, I was also the founder of the National Hispanic Medical Association. But 30 years ago, 20 years ago, we decided to change our foundation's name from the NHMA Foundation because I saw the importance of working with the healthcare team, nurses, dentists, pharmacists, and bringing together a big scholarship program for Latino students. So we changed our name to National Hispanic Health Foundation. And just last year, I was pleasantly surprised that one board said, could you work for us full time instead of me working part-time for both? So anyway, here I am, and the mission of NHHF is to transform the healthcare system through leadership, research, and education. and I'll talk more about that later. Thank you.
Thank you, Dr. Rios, for that. So we're gonna just jump into Q&A. We have a lot to cover. As mentioned, there's so much happening in the health space right now. So I want to make sure that we have time to touch on all of it, or at least some of it. So I just want to start off with diving in, and this is for all three of you. With the defunding of Medicaid on the chopping block, how can we foresee this issue of asthma and uninsured rates and underinsured rates just skyrocketing for Latinos?
I can start first, and maybe I'll sort of lay the groundwork for what this cut really means. So, it's really detrimental to communities of color. There's something like 42 million people of color. So this is like not just Latinos, it's African American, Asian Pacific Islander, Indigenous populations are all at risk of losing their health coverage in some way or another. So this might be where a state would require they instill Medicaid work requirements, meaning you have to work at least part-time in order to qualify for benefits. And we know how problematic that could be. If you're sick and you can't work, putting in a work requirement in order to be eligible for Medicaid is a major barrier to access. Another thing is to think of all of I think for our community is there are 20 million Latinos, just Latinos alone, who have Medicaid, and it's adults, it's people with disabilities, not just children. And I'll say that, yeah, we always think of Medicaid as the children, and it's true, we'll talk a little bit more about, I just sort of like to paint a picture of immigration here, it's so very relevant, but 93% of overwhelming majority of Latino children in the US are US born, so they are citizens. The distinction is that 1 in 4 have a parent who is an immigrant, at least one parent who is an immigrant. And so that is where a lot of the immigration policies, in addition to the Medicaid, work requirements, different restrictions, end up from the community and putting those at risk from losing their coverage.
Yeah, and I'll add to that. So Medicaid and CHIP cover nearly half of all children with asthma in the United States. So this is, potentially devastating for many populations. But as Jet was saying, Latino families are disproportionately reliant on Medicaid. And, when we think about the lack of access to healthcare, it's everything that stems from that. So this means we're losing access to controller medication. This means we're losing access to specialists. We're losing access to all preventive care. And unfortunately, as Allison mentioned, people often think of asthma as just asthma. 10 people still die every day from asthma. It is it can be a manageable disease with the right tools. Access to care, coverage, and medicine being one of them. But this potential cut to Medicaid has even larger implications. Lots of hospitals get their funding from these populations. So this means closures of, systems. If you don't have access to, if your closest hospital closes, where are you getting care in an emergency? It's going to, potentially lead to a lot of provider fatigue, which already exists, and we have a lot of shortages there. This affects more than people on Medicaid, more than just people on Medicaid. And so thinking about the whole healthcare system and what this will do to it, what we've been saying at AFA is, these cuts are not savings. People are still going to need that care. And they're going to end up in the ER, getting that regular, that's where the very costly asthma hospitalization is going to occur, rather than it is a lot cheaper and more effective to have access to preventive care. And so, this Medicaid cut is just a huge step backwards in addressing health disparities. And so we, have been encouraging our members of Congress to really see the issues here and help protect it. But it's $880 billion over 10 years is going to be devastating.
Yeah, I'll just add to that. It's devastating all the way around. Medicaid is the largest insurance program in the country. I come from California. I mean, I live here in DC, but in California, 1 out of 3 people are on Medicaid. Medicaid is just an insurance program, just like anybody else, any other insurance program. You need to take care of programs and policies to help the people that you cover, those that are eligible for Medicaid. So what is this Congress looking at? Especially the Energy and Commerce Committee has been told that they have to get rid of the $880 billion. I just heard Congresswoman DeJette at one of the health policy summits say $500 billion is what they cover in overall. So in order to cut back, they have to cut into Medicaid to get to the $880 billion that they've been required to cut. I'll just say the Republican ideology is kind of hypocritical when you think we need to have better chronic diseases. Guess what? Asthma is a chronic disease, so everybody needs to understand that. Push for chronic disease, including asthma, not just heart disease, cancer, diabetes. Asthma is a chronic disease. The other thing Republicans are saying is that we're only going to get rid of the fraud and abuse. And guess who's the fraud and abuse stakeholder with that, with Medicaid cuts? It's the states. The states need to cut back. This is not what I believe, but the states need to cut back on fraud and abuse. Okay, well, they say fraud and abuse are waivers that allowed California to take care of undocumented people, that allowed more states to take care of more children, that allowed states to take care of pregnant women from 3 months to a whole year postpartum. These are reforms that have advanced access to care for our communities, especially the Latino communities. So if you want to call that fraud and abuse, we need people to learn the lingo. It's not fraud and abuse when you're talking about people's lives and families' lives. You're going to see high school, K through 12 students who have asthma not have nurses in their schools. You're going to see college health centers not be able to provide asthma inhalers. You're going to see people working that are going to have to leave work and not, have funding for their families because they can't breathe and they need to stay home. And not to mention, if we have another pandemic, respiratory pandemic, especially bird flu, for example, and asthma will go through the roof in our communities. And there's a lot more to talk about, but Medicaid is not just Medicaid cuts, which are going to happen. We need to protect as much of the Medicaid program as possible, and that way we'll help our communities.
Can I add a point here? I just wanted to add to illuminate the impact of states that cover children regardless of immigration status. So immigration does have an impact. So there are 14 states and DC that provide coverage, Medicaid, to children regardless of immigration status. There are 37 states plus DC that cover lawfully residing children without that 5-year wait, right? Many of us are aware of the public charge rule, right? Where someone who has their newly minted immigration status has to wait 5 years in order to be eligible for Medicaid. So again, there is a false narrative out there that all of these people are getting their green cards so that they can get Medicaid. Well, we still have to do the 5-year waiting period. And we, in only 37, I say only because we have 50 states, so we do need all states to provide that I would say like a waiver to allow states to cover children, outside of that 5-year waiting period.
And I'll just add one thing to perhaps help with a narrative to Republican offices. Asthma is like one of the most common and costly diseases in the United States. It costs the U.S. economy $82 billion every year. And that's data from 2013, which we've also been working to try to get that data updated with the gutting of CDC. We'll talk about that later. That's old data, so we can only imagine that number has actually increased. So again, when we're talking about cost savings. This is not it. This is not the solution. And that is kind of that's what we have been trying to remind Republican offices of. Again, cuts are not savings, not to mention, the poor health outcomes.
Thank you all so much for that discussion. I mean, we just heard that rural healthcare might, be affected by this. I come from a rural community. My community is predominantly Hispanic on Medicaid. I grew up on Medicaid. We've heard about provider fatigue. Providers, there's already a shortage of providers. And so what are we going to see now if healthcare might be cut, especially in the rural communities with families who have asthma? And then we also heard that asthma contributes to $82 billion in costs from around the country. And so what that means now is going to be passed down to families. And you said from 2013, we can only imagine how much that's going to continue to go up. So we've heard, some little back and forth about HHS restructuring. So let's talk about it. We see on a daily basis that HHS has began to restructure, reducing CDC, FDA, NIH, and other essential agencies. What might we anticipate from these changes? And feel free for all three of you to go ahead and answer.
I guess I'll start and then go down. So the one thing I'd like to highlight about the restructuring and the changes at HHS, perhaps of all the leadership changes, HHS rescinded a rule which required the agency to publish pending regulation for public comment period. And so there's a process for when an agency proposes a regulation or a change. And typically there's a 90-day notice given the public to comment on pending regulation. And so this is where stakeholders, patient advocates are able to submit their comments and engage with the agency officials and let them know how these pending regulations will actually impact their daily lives. And this administration rescinding that rule for HHS not just places, like a gag order on the patient advocates who want to engage with the agency, is it really does create less transparency within the agency. What are they doing? We won't know until the rule comes out. I think builds more mistrust within the agency, right? When these rules were put into place, it was to really create a transparent, open government so that we could see what's going on and have a say. And so that's a really big change that's come with this administration.
So I have so many notes up here because there are so many things that impact the asthma community that have been affected by all the restructuring. So I'm going to try to, work backwards. So a few weeks ago was when HHS, I think piggybacking this, they actually have a proposed rule. It did have a 30-day comment period, which is very short. So that's, but it's about ACA enrollment opportunities. One of the things that is going to be rescinded is DACA eligibility. So while that impacts up to 100,000 DACA recipients, so you are no longer going to be able to get healthcare coverage through the marketplace. So that's a bad number one. Asthma is a disease where your physical environment impacts you very greatly. Asthma symptoms can be triggered by, I don't know if you've noticed that it's been yellow outside. Allergens are a very common asthma trigger, as is air pollution, air quality, respiratory illness, as we mentioned, puts you more at risk for severe health outcomes. But the Latino community is what we call the victim of pollution inequity. So when we did our asthma disparities report, one of the things we found is that the Latino community experiences what we call a 63% air pollution inequity, whereas white people in the United States have a 17% health advantage. So essentially they are producing the pollution, but it's not impacting them. So that means that these are communities that are living near highways, sources of air pollution. In rural communities, you're getting exposure to pesticides, things like that. One of the ways that this was being addressed was the environmental justice offices at the Environmental Protection Agency. those have been eliminated. So this administration is also targeting clean air policies. So we have something that's called the National Ambient Air Quality Standards for particulate matter. So this is, the tiny particulate matter that, if you breathe it in, it's so small it gets into your lungs and even your bloodstream. So it has, incredibly detrimental health impacts. They're looking to use a CRA to rescind those, even though they are not eligible for CRA. These were finalized before the period that they should be. So that, in the environmental space, we have a lot of issues. Most recently, the RIFs at HHS last week, hugely detrimental. So it eliminated the entire division of environmental health science and practice at EPA, which was in the environmental health in the center. So this eliminated the asthma and air quality branch, the climate and health program, those are the most pertinent here, but also the environmental public health tracking branch, the emerging environmental hazards and health effects branch, lead poisoning and prevention, which RFK claims that, that must have been a mistake. Walking that back now too. But this is really significant because that program at CDC houses the National Asthma Control Program. So this is a program that has been around since 1999. It is incredibly effective because it promotes community-based programs. So at every state, we always say all asthma is local because all communities are different and you're going to be impacted. You might have different needs to help address your asthma. So by eliminating this program, which since its inception, we've seen asthma prevalence actually rise, but mortality rates have gone down because through education, through preventive services, through understanding asthma management and community-based programs, you can manage it. So we are really concerned that this program has been eliminated. It is one that we work, towards supporting every year. So that is our biggest call to action right now in Congress is what about the National Asthma Control Program? This is going to put us, this harms health. And we see this as a huge issue. Another office that experienced a lot of RIFs last week was NIOSH. So the National Institute for Occupational Safety and Health. So this is where we look at occupational related health issues. Asthma is one of the most common. This is because exposures to, chemicals, pesticides, these can not only exacerbate asthma, but can also cause asthma. So this is another hugely detrimental loss. Ultimately, these are all attacks on public health. And without a public health infrastructure, we are going to lose lives.
I'm just going to add that restructuring in the government is not a new thing. But the last major restructuring in healthcare was when HEW became three different agencies. HEW was Health, Education, and Welfare. And health became its own agency, education became its own agency, and welfare became its own agency. And I'm not going to go into detail, but let me just say that's how big this disruption is. It's the most major disruption for public health since then, and that was in the 1980s. And again, this is the disruption and reorganization means that there would be a centralization of funding. So instead of having, public relations offices in every single agency, let's just combine them. That sounds good. That sounds, we're going to decrease costs at a more business level, But when it comes to the lives of people that depend on programs, the grants that have been given to our community-based organizations, the research that has been provided to the careers of researchers in this country. Universities are now closing their admission programs. Johns Hopkins just closed PhD programs for the next few years in health research. Other programs are actually, other universities are just changing, what they can do to decrease their programs that they get funded, because the overhead costs were changed at NIH from 50% to 15%. Huge amounts of dollars being cut out of research. And we can't do policy without data. And just like Jeanette mentioned about the importance of community-based research, under the COVID pandemic, you may not realize this, NIH shifted from just doing bench research to actually doing a little bit more community-based research, because they realized that you can't just eliminate a horrible disease like asthma or COVID without educating people along the way and having the community involved in research so that it matters to the community. And people get engaged in community when you talk about community participatory research. So anyway, I'll just stop there. But I mean, it's just disastrous what we're heading into. And I'll just say this reorganization will not come back for quite a while, because it'll take more policymakers to understand one program at a time, how can we bring it back? Instead of looking at the big picture and just say, we need to take care of people first, and understand how to get rid of fraud and abuse, but not make it cut out the whole program for our communities.
Yeah, I'd like to touch a little bit on the impact to research and just give you an example of what the CDC does. I think CDC is known for, we do, we say infectious disease surveillance, right? Well, they also generate a lot of surveillance data on asthma, right? So they track morbidity, mortality, hospitalizations due to asthma, emergency department visits due to asthma. And so all of this type of clinical data, surveillance data, is housed within CDC. If we don't have that data, the research can't happen. And then not just the research, but the physicians need their clinical guidelines to be updated as well. So an example of how these organizations collaborate is the National Heart, Lung, Blood Institute, which is part of the NIH, the biomedical research part of the agency, collaborates with CDC, which are the epidemiologists, right, the data folks. And then they collaborate with medical experts. They do advisory panels to engage the stakeholder community to update clinical guidelines. And they do this to benefit the patient, right? Things like this, these are the types of activities that federal funding does, because the private industry isn't going to do it. Do you think that the Mayo Clinic is going to pay for this, or Cedars-Sinai Hospital is going to pay for this, so that the guidelines, the clinical guidelines, will be updated for it? I know that the physician associations can't pay for it, and so that's why the federal government does this. And it's a very much needed enterprise to maintain the quality of care and those gold standard, medical services that we rely on. People come from all over the world to the U.S. for medical care. Why? Because we have this type of infrastructure. So
I'll add to the data point. So the asthma surveillance largely comes out of the National Asthma Control Program also. But it already, we don't even have childhood asthma data in all 50 states. We were behind the ball, and this is going to put us even further behind. Year over year, generally when we've asked for increased funding for the program, it was to shore up national asthma surveillance data. So we're going to move backward on that. And I think one important note here is also, what kind of data were we collecting? A lot of U.S. health data is just Hispanic. I think we all know that, that encompasses many diverse cultures and countries. And in asthma, where we do actually have a little bit of, it's important to think about the subgroups where we can, because there are significant differences across them. So in the United States, with the data, the Hispanic population actually has a relatively low asthma rate compared to others, but that's not the case for all subgroups. Puerto Rican Americans have the highest prevalence, asthma prevalence, compared to any race or ethnicity in the United States. It is almost 2 times higher than white Americans. It is wild. So it is so important to have disaggregated data in order to, again, address the disparities where they exist. to better understand them. Is there a biological factor? Is it strictly environmental? Is it this? This is all so critically important to treating asthma. And so without all of this data, we're just going to continue to see these disparities grow.
Thank you so much. That's a lot to digest, but I just want to touch on a couple of what we heard, right? Community education is going to be really important for making sure that health equity is achievable. And with the restructuring of HHS, we might not know what that's going to look like for the future. Occupational research, research for community health, research for DACA recipients, research for asthma is all at stake with this restructuring. And unfortunately, that can lead to the pollution inequity, particulates that children, families, especially farm workers. My grandfather was a farm worker and died of environmental health. And so that's why these issues are so close to me. And so, just make sure when you are seeing these things happening, please pay attention, and let's reiterate how important all of this is here in Congress, since we are on Capitol Hill, and take a moment to appreciate where we are. And so that leads me to wanting to ask specific questions to Jenna. Let's start with you first. I recently saw that you published AAFA's 2025 State Honor Roll of Asthma and Allergy Policies for School identifies, where schools to identify these gaps, which affect nearly 5 million children nationwide. Can you tell us a little bit about more of this and your findings?
Sure. So as I mentioned earlier, your physical environment is very important to asthma. Everyone in the United States spends about 90% of their time indoors. So for adults, that's because you're either at home or at your workplace. For children, you're at school. So your school's physical environment is critically important. So we put out this report at Asthma. We've been doing it at AFA since 2008. This past year, we updated it. So now it has 27 core policy standards, where, about half of them are related to medication and treatment in schools. The other half is related to the physical environment in schools. So we look across all 50 states and U.S. territories. And unfortunately, only 2 states made the state honor roll this year. And I use this, in the report explain this, states, I use that term generally if we're referring to the territories or DC. So Connecticut and DC were the only states that met at least 22 of our 27 standards. And we, just found a lot of gaps, obviously, in policies that keep children with asthma and allergies safe in schools. One of the big ones was indoor air quality. So we are sending our children to very old, very underfunded school buildings that are making them sick. And one of the major social determinants of health is educational attainment. So we are putting children behind from the get-go. If you're not able to learn, asthma is the #1 cause of missed school days. When a child isn't in school, that parent isn't at work. It has, it just has ripple effects. So in our report, there's also the availability of school nurses, another major gap. Only 2 states require that there's a school nurse in every school. For a lot of children, this might be their primary source of care, that school nurse. So, emergencies happen at school. Some of the policies there's, is a school able to stock undesignated asthma rescue medication? You might have your first ever asthma attack in school, and if they're not prepared to treat you, God forbid something terrible happens, but tragedies do happen. So one of the things, again, with this report, we don't just want to talk about all the problems, we do like to talk about solutions. So with that report, we also put out an advocacy toolkit. So these are state level issues, but there are opportunities at the federal level as well. So I'll highlight 2. There is the Healthy Indoor Air Quality and Healthy Schools Act. This is a bipartisan bill that will be reintroduced shortly. Representative Tonko and Fitzpatrick. Essentially, it is a way to help schools manage indoor air quality. We don't have guidelines. So I mentioned the National Ambient Air Quality Standards earlier. Outdoor air only. We do not have the equivalent standards for inside air. There are ways to manage it. Some states require management plans, but we're definitely behind the ball. And I once heard an example to explain like the importance of indoor air quality. You were walking down the street and somebody handed you just like an open cup of water. You know, are you taking it? We do that every time we enter a building. We are breathing whatever air is here. And I think COVID kind of shone a light on how important indoor air quality is in health management, but we need to take it a step further. So that is one federal, you know, the Indoor Air Quality and Healthy Schools Act is one federal example where we can, you know, put out some guidelines to help states manage. Obviously, if we're cutting the Department of Education, this is a whole other issue. And the other one is there is a bill called One School, One Nurse. So this would provide federal grants to schools to help them fund school nurses. I will not purport to think that this is going to pass in this Congress, but it is an important messaging bill because it is a very important issue. So yeah, like thinking about, and the way our schools are funded are also exacerbating health disparities. So the lowest resource communities have the lowest resource schools, unable to address air quality, improve HVAC systems, get filtration, all of the things that would be required to help children, you know, have safe and healthy learning environments to, you know, get them started in life. So I would encourage you to look at the report. You can just go to statehonorroll.org to learn more there.
Thank you so much, Jenna. Yeah, definitely encourage everyone to take a look. There's a lot of great information. And so now I want to pass it off to Dr. Rios. So with your background with medical training and your master's in public health, as well as your background as a president, I'm curious, what is the biggest hurdle you see families facing when trying to treat asthma?
Well, so much has already been said about the nature of asthma and the challenges for people that have asthma. Let me just put it this way, we need access and affordability. And I'm going to focus on two things. One is the pharmaceutical mandate to take care of people with asthma, whatever pharma companies, and I'm not trying to talk about any one company, but whatever companies are making our inhalers, our corticosteroid inhalers, or the Atrovent inhalers, or the you know, the spacers, all the different devices. And so let's say pharma companies and device companies, I think need to be pushed to do more for the Latino community. And what I mean by that is you see a lot of programs that come out for, let's say, clinical trial diversity. We want people to be in and have diverse people involved in research that the pharmaceutical companies do to create their devices or their medications. But very, very few Hispanics even get involved. They have internship programs. They have educational programs. I think we need to open the doors to the corporate sector and the business side of medicine to help young people get jobs, get understanding within their communities. The other thing, and that's access in a way, right? But the other thing is affordability. People also have, and I'll just say pharma companies do have patient programs, patient assistance programs, but how many people know about it? And we need more education in our communities about the importance of these programs. The policy implication is I think it's important to put into guidelines when we talk about these kinds of programs, that there should be transparency, let's say, about the importance of educating our families. The second thing, and this is really big for those of us that have gone through the educational system and see the disparity from a different perspective, and that's workforce. We need more Latino students to understand if they're good in math and science, they're a STEM student, they can go into any of the health careers. We need all health careers, including community health workers, physician assistants, nurse practitioners, nurses. You know, you can go to a junior college, community college, and become a nurse. Doctors, pharmacists, dentists, all of them make a difference in their community. There's been studies that have shown, especially Latino and Black, doctors and dentists take care of their own people. They're magnets. And so many people in our community only understand or take the messages from the doctor or the nurse, at the clinic. It doesn't have to be a major institution, but there are trusted messengers. And I think what we have to do is not only increase the workforce training programs in this country, but they have to change. They can't just be a few people. Only 6% of doctors in this country are Hispanic, and we're about to be 1 out of 3 Americans. So we're way behind. And so when you talk about asthma or any other chronic disease, if we had more Latino families having Latino doctors and nurses and pharmacists at your local pharmacy, you'd get more of a cultural shift in our communities that health is important. And of course, let me just say, we need healthcare for everybody. We all talked about Medicare for all or Medicaid for all, and now we're about to see it all destroyed. But I do think that health is something that's very, very important for families to understand that they can feel better, they can have quality life, they can study, they can go to work and be productive. And I'll just say this, Latinos have the highest record of optimism and small business and helping each other. We just don't understand that we need to build on that asset and help people help themselves. And our families really need that. And I think, I'll just say the other disaster with Medicaid unraveling is that our community, despite the Affordable Care Act, still is the largest community without insurance. And we don't have the funding to go to seek care all the time, right? But people don't realize how expensive it is not to have treatment. That's why it's so important that we do understand the importance of medications and inhalers, et cetera. Because if you end up in an emergency room and have to be hospitalized, it's going to break that people go to bankruptcy. Number one cause of bankruptcy is the medical bills in this country. Once you get into the hospitals, it's just so, without insurance, it's unfathomable. People don't realize how much it costs. So whatever we can do to get more people involved in the healthcare system, to expand our community health centers, to expand our safety net, I think that's one of the biggest things we need. Working with the corporate sector, the business community, to step up, because the federal government is about to implode healthcare in this country.
Thank you, Dr. Rios. Just reiterating, of course, cultural competency is going to be so important when families go in to seek medical care, understanding that there is someone there that not only understands their language, their community, but how they feel, how nervous they are. It can mean a world of difference in the healthcare. So I want to come back now to Jeanette. I know you just recently founded a Latino health nonprofit aimed at empowering underserved communities in the U.S. to achieve optimal health and well-being. Can you give us an insight on how you're working with Latinos to achieve this optimal health in such a harsh healthcare environment?
Yeah, I think it's probably, there's no perfect time, right, to start something, but there's no more important time for me to start this organization. The approach and the strategy that we're going to use is to really go to the communities and lift up the best practices that are already working. And this is where I'm very solutions oriented, and I am super optimistic. Maybe like the characteristic of a Latino is that I am like hopelessly optimistic. There are so many communities out there, what we like to call bright spots sometimes, that are doing things right, and they have formulas that work. There are community-based organizations that are working with hospital systems, that are keeping communities healthy, that are providing, social connectedness. These are like little microclimates that are happening all over the country. And what I'd like to do is take those examples, write them up, bring them to Capitol Hill and show policymakers how these community programs are working and what the secret sauce is to those, and how their support of these can help communities all over the country, right? So it's really leveraging what things work to inform policy development that's going to impact communities that look like those that are already working. So we're going to have some public policy fellowships. So in the next year, hopefully, if you're postdoc, young professional, we will have some fellowships for you to do some research based in your community, so that you can work with your organization and build an infrastructure, build a community there to do health literacy, right? Where, I mean, some of the asthma prevention strategies that we talk about are, making sure that you keep your home in with low humidity. Well, do you have access to dehumidifiers? Or is there something you can do, like open a window when you shower, so that you make sure you, use the fan in the bathroom so that you reduce the humidity in your house. I mean, these are things that we can do, some common sense things. I laugh at sometimes saying like, oh, well, everybody needs a HEPA filter in your house. Well, how expensive are those, right? So when you can't do that, what are some of the other strategies that you can implement in your home to make your home more, easier to help you manage your asthma? And so it's looking at strategies like that, I know that community health workers often are the missing link, and they are community leaders that help to not just share resources, they do health education, they help people enroll in healthcare, they help people manage their chronic diseases, they come and they do medication, counseling with folks to make sure that they're taking everything accordingly. They help with compliance with medical, with directions, right? Your doctor says you're supposed to do A, B, C, and you didn't understand B, so you're doing A and C. Well, these community health workers sit down and make sure you understand the treatment plan, and it helps with compliance and reduces those hospital administrations. So this is why I think that, we need to lift this up, because I'm going to help to try to make a business case for how hospitals and public-private partnerships can help support these community-based interventions that really create overall health and well-being in our communities.
Thank you so much. I mean, it sounds like there's so many great opportunities, and maybe it's the optimism in me too, but not necessarily dwelling on what we're about to lose, but where we can gain and find the support. And it sounds like, the nonprofit is a perfect way to do that, especially being community health workers. So I think we have time for one more question before we turn it over to the audience. And so I just want to do another one for all three of you. And what advice would you give someone interested in doing work at the intersection of public health, health equity, and Latino communities?
Let me just say, I think it's so important to realize how there are many opportunities in your own communities. We just need more support and funding for them. I'll go back to the training pathway. If you're interested in healthcare, whether you go into public health or healthcare delivery, you can understand the problems if you get inside the system. So work in a hospital, work at a pharma company, work at an insurance company, work at a clinic, but think, how does this impact my community? Community-based organizations are another excellent way, and Jeanette's talking about an excellent way to bring together the public health perspective with the research or medical side perspective. So anywhere you go in your communities, are you have to think about the connections of understanding the problems, seeing strategies, but take it to the next level. What would open the doors for the Latinos to come in? Latinos don't trust the system. Latinos don't understand the system wherever you work. So it's up to you to see the connections. And I think the more we can get into media and let community know, the more we can actually publish and let other professionals know. And we need to help America that is going to be Latino more than anybody. Most people don't understand that 1 out of 3 Americans are going to be Hispanic in the next 10 years or 20 years. So we really need to prepare now with helping strategies become focused, culturally competent, linguistically appropriate, so that more Hispanics in this country can have better health care. and more Americans can have better health care or healthy lifestyles, we'll say.
I'll add, so, I think we started today with a kind of maybe a bleak overview of what's happening federally. There is a lot of opportunity, again, at the community and the state-based. And I think maybe that is so important to note. Like, we're talking death and doom, but there's a lot of opportunity. And to Jeanette's point, community-based organizations, they exist and they're doing great work. And so I think it is that, how do we, show the results? How do we, APA's been doing some of this work since 2022. We have partnered with community-based organizations all over the country where we fund the CBOs to actually do the asthma home visiting. The important piece is that you have to connect the research with it. So there's a lot of opportunity to help those organizations who are doing the work to really show their work, because that's how you get the policy change. So in California, for instance, they actually are one of the few states, Medi-Cal, Medicaid in California, they pay for community-based health workers to be housed in a community-based organization, not just at medical institutions. They also pay for asthma home remediation. They pay for asthma home visiting. So these are things that when your insurance is paying for these interventions, we have the data that shows this is actually cost effective to do this. So it's really, I think thinking about how, each community can benefit, and there's so much, unfortunately, there's so much opportunity because they're, it's such a multifaceted, there's so many multifaceted drivers of health. So there's opportunities in all kinds of sectors. And I do think, if we want to there are policy solutions that can happen at a state level where we might have a little more traction in the next couple of years.
Yeah. So I'll add that all politics is local has been a saying that I grew up with as a poli-sci student. And it's never been more relevant because in a way, it's like Congress has been broken for a little while. Your state governments and legislators are still sort of fighting a little bit, right? And working with limited resources. And so this is why I think that my focus going into the community is like your hyper focus of, where you can have the most impact is more true now than ever, because only like you can band together. And I wanted to highlight some interesting things that I've been learning over the course of the last couple months and the work I've been doing is that I'm finding that there is more need for peer-to-peer support services that I think young folks can take advantage of. I know that maybe some of you are familiar with like mental health 101, right? How to talk to somebody, engage with them when they're in a mental health crisis. This is something that's probably come out of COVID, right? We're destigmatizing talking about mental health. We're also destigmatizing, I think, substance misuse. I don't want to call it abuse anymore, substance misuse. And particularly with the fentanyl crisis, right, where we're finding that it's probably useful for everybody to know how to administer naloxone when someone's, having an overdose. How do you respond when that happens? I get, emails from my client school system that says there was a fentanyl overdose in our community. It's in our communities. To ignore that, substance misuse is a problem. Misuse is a problem is for us to not be prepared, right? If someone gets naloxone within the first 5 minutes of an overdose, you can save their life, and if you wait 10 minutes, they're dead. So it's, this like sort of quick response things that we should really probably be teaching in high school and middle school. I just came from another organization's event where they did a seizure response training for folks that attended, which was fascinating, right? How do you respond when someone's having a seizure? And there was a young man who spoke that he's like, I was 22 when I had my first seizure in a classroom, right? And nobody knew how to respond, right? So then I think, okay, well, there are all these sort of like public healthy kind of things that we can learn to do to be maybe a more informed, connected society if we learn how to do emergency first aid, right? Emergency CPR. maybe everybody gets one of those little pocket protector things that goes so you can do safe CPR and not get grossed out about it because you're in high school, right, in practice. I know I took a CPR class when I had a baby because they teach you infant CPR, right, before you take your baby home from the hospital. You take some classes during your last trimester. So different things like that. I'll say that moms are more prepared for things because we have to be prepared, but dads can too. And as youth and young adults, which we are, the Latino community, is really young. The average age for Latinos in the U.S. right now is 30. Many of you are probably close to 30. But 1 in 4 children in our U.S. schools is Latino. So we are, a good majority, like 25% of all children in K through 12 are children. So we want to, one of the whys for why I went and started this organization was to really provide support to our youth, our adolescents that are about to mature and go into, careers, college or tech or whatever. And then the young adults who are now starting families, right? So, yeah, I think I'll stop there. But I think that there's a lot that we can do to sort of empower the communities and take, leadership within your own community.
Thank you so much. So now I just want to take the opportunity to turn it over to the audience and see if you all have any questions for our panelists. Feel free to direct a question to all 3 of them or anyone individually. If you have a question, go ahead and raise your hand. Okay, Adonis.
Yes, I have a specific question regarding the Asthma Alley in the Bronx. I know you specifically mentioned that Latino communities have the disproportionate rates of being affected by air pollution. I'm also a New Yorker, so I understand the air pollution in those urban areas. So can you speak specifically to the Asthma Alley in the Bronx and how research from that has helped improve the outcomes for Latino communities? This is right.
I'll start. Yes, so the Asthma Alley, I remember, I think I had just started at APA back in 2018. One of the first things I saw was a documentary on the Asthma Alley. And it's very disconcerting to, one of the questions they asked is like a classroom of 20 students, and they just asked, how many of you have asthma? And basically all except 2 kids raised their hands. So it is, the Asthma Alley is basically, it's right by a trucking hub. So there's a lot of, and transportation is the leading cause of greenhouse gas emissions in the United States. And so, there's all these diesel emissions happening right by their schools. They're walking to and from school. There is, one of the things that we haven't really talked about is how our changing climate is also impacting asthma. So I think maybe you've noticed in the last couple of years, like your allergy season is worse. More CO2 in the atmosphere actually makes plants produce more pollen and for longer. And so, understanding what all these triggers are. So, maybe that means on a day of high cloud when you're walking to school through all that pollution, do we need to start wearing masks outside, which we would actually encourage. But again, that community is so disproportionately impacted, but asthma education, that's where that asthma education and self-management becomes so important, because telling someone just to move, that is not a solution. So, it's really, I think that highlights the importance of you have to, work with the community-based organizations. APA actually works with an organization called Air NYC, which works in the Bronx to help, address these, help, give that education, learn about, how to properly use an inhaler. You'd be very surprised how misused they are. A lot of kids, they might not be using a spacer when they should always be using a spacer. This comes to an access issue too. Some insurance companies don't cover the spacer, they only cover the inhaler. And if you're under 6, you absolutely need one. So yeah, I mean, it's unfortunately a terrible example, but a shining example, how all of these factors that contributed to worsening asthma impact the community so greatly. And then, trying to look at the ways in which to address that.
Go ahead, Heidi.
Question for Jenna. I know 75% of inhalers are metered dose inhalers, which use HCS, which are high fluorocarbons, which are 1,000 times worse than carbon dioxide in the environment. Is your organization pushing at all for dry powder inhalers?
So this is a very interesting question. In the grand scheme of what is contributing to climate change, asthma medications is such a small contributor that what we are worried about, there is going to be a transition to what we call green inhalers. Dry powder inhalers are not appropriate for all asthma patients. So children, a dry powder inhaler is essentially, you have to have the lung capacity to be able to breathe the powder into your lungs. If you have severe asthma and perhaps limited lung capacity, those won't work for you. Children, it's very difficult to use, they don't understand. Senior citizens might not have the dexterity to use them. So dry powder inhaler, when appropriate, great, let's do it. This comes down to an access and affordability issue, which we could start talking about patent tickets if you wanted. With the transition to green inhalers, this will be good. So we'll be using a different propellant that, pharmaceutical companies are already working on this, to be frank. But what is going to happen, unfortunately, what we predict is going to happen is this will put all of those inhalers back on patent, so there will not be, cheaper generics available. The affordability of these inhalers, is prone to go up. So what we at AFA are advocating for is, people need to have access to the asthma medication that works for them. And right now, if that is a metered dose inhaler, then that needs to be what they continue to have access to and can afford. As we transition to green inhalers, we want to make sure that these patents are not disproportionately impacting certain communities and limiting access to them, because unfortunately it is medically necessary to have a metered dose inhaler for many patients, especially children.
Okay, we are almost out of time, and so I just wanted to take a moment to deeply thank my panelists, Jeanette, Jenna, and Dr. Rios, for your insight into all of these issues. Just, of course, want to wrap it all up with saying that community health is really going to be where we look towards the future and helping Latinos with insurance, social determinants of health like housing, climate, and making sure that we have a healthier future. As we've heard, throughout the couple of days, mind you, this is the third day of CHCI's briefing, we have housing fellows, we have a climate fellow, health, and education, child welfare. And so health definitely encompasses all of these issues combined. And so as we take just these last couple of moments, I wanted to appreciate and thank you all for coming here and just wrap it up and see if you all have any last couple words in our last 1 minute.
Well, let me just say that at the National Hispanic Health Foundation, we also welcome interns, and we have a great intern here from CHCI. We also have our staff here, and I think that what's important to realize that here in Washington, D.C., you need to network, and whatever we can do to help the National Hispanic Health Foundation, it does have a scholarship program for young people that are in the health profession schools. If you know anybody that's a medical student, nursing student, pharmacy student, public health student, PA student, we are more than happy to get them engaged in our scholarship program, and we have a mentoring program for them too. And I think that that's more important than anything else here, is that you learn successful strategies from those that you meet so that you can generate more ideas for Latino policy in healthcare.
I'll add, we also love interns. I think that the future of health is in young people. And I think at APA, we look forward to systemic change to, address the issues at hand. And I see that in this room. So, again, I think there's a lot of encouragement today to look into your communities to see the opportunities, because there are so many. And APA, is always willing to be a partner in this. We have a ton of resources. Because we're such an old organization, there's a lot of historical knowledge there, and we would love, policy interns are always welcome, and just thank you for all that you all do.
I am going to ask for interns as well, so. That's great. Now, I know that many of you will be looking for employment soon, so keep us in mind as well. Yeah, so go to latinohealthadvocacy.org. That's our organization, and you'll be seeing more of us. Thank you.
All right, thank you all. That concludes our presentation. Thank you.